was first really took a deep dive into this when this book, if you've heard of it, I Am Jazz, was read to kindergartners in our local school system. And a parent urged me to read it as an endocrinologist. And this is a propaganda book geared towards very young kids, kindergartners and elementary school. And I found at least a couple of things that were untrue claims in there, that a boy could be born with a girl's brain, that a doctor could somehow diagnose a child as being transgender. And there was a lot of information missing about types of medical harms that can happen with this treatment. So gender identity is an internal feeling of being a boy, a girl, or some variation. Gender dysphoria is a legitimate psychological diagnosis found in the DSM-5 with an extreme discomfort with one's sex and perceived gender, leading to significant distress and impairment of functioning lasting at least 6 months. And it's important to know that depending on which study you look at, so long as kids aren't interfered with hormones, the majority, 50 to 98%, will desist or grow out of this by adulthood. Also important to know is that many of these people, as you've heard today, have other coexisting psychological comorbidities such as anxiety, depression, or autism, self. Now, as an endocrinologist, I provide hormones to people. Hormones are very powerful medications that alter body and mind. And so if I'm going to give insulin to a patient, I'm going to make sure I have some objective evidence of diabetes. I want glucose results. If I'm going to refer a patient for a thyroid cancer, I want a biopsy to show me for sure that this person needs this treatment. So we're going to radically alter, as I said, people's bodies, kids' bodies with hormones. How can I prove that this person is transgender? Where do I find the gender identity? Can you do a CAT scan or an MRI or chromosome testing or other testing? And the answer is you cannot.